Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
No. Laser therapy. Now in the glaucoma, we also have laser therapy can be used in glaucoma. Right. In the glaucoma, we also have laser therapy. In the laser therapy, we have organ laser trabeculoplasty is present. So what is this organ laser trabeculoplasty? Now with the help of this organ laser trabeculoplasty, that is with the help of this laser will actually burn the trabeculum. This laser will burn the trabeculum, especially it burns the trabeculum at the junction of pigmented and the non-pigmented part. So once trabeculum is burned, there is a hole like or a passage will be developed. This will help in drainage of the aqueous humor. It is mainly useful in open angle glaucoma with pigmented trabecular meshwork. Like it can be useful in conditions like pigmented and exfoliative glaucoma. So why? So what is happening here? Here this is the sorry. This is the cornea and this is the iris. Here there will be a trabecular meshwork. Now because of the pigment deposition in the trabecular meshwork, there is closure of the trabecular meshwork. So if you do laser and if you give a laser and if you actually cut this or make hole in the trabecular meshwork so that the aqueous humor can directly drain into the trabecular meshwork, then Clem's canal to the episcleral veins.
thank you and thank you for watching.